Hello everyone, this is Dushyant Magu from MedSurge India, and today we have joined by a leading hemato-oncologist, Dr. Subhaprakash Sanyal from Fortis Mulund Hospital. He is currently working as a Director Hemato-Oncology and BMT Department. Welcome, Doctor.
Thank you.
Today we'll be discussing about various types of blood cancers and blood disorders and the role of bone marrow transplant in its treatment.
So blood cancer, you have to understand, and what is a cancer? So cancer means any uncontrolled proliferation or growth of any tissue which has no control anywhere in the system. So when the blood cells are proliferating in the bone marrow, increasing in the quantity without any control, that is considered as a blood cancer.
So is stem cell transplant and bone marrow transplant are same?
Yeah, so you can call it interchangeably, but you know what? Previous times when we are collecting the stem cell, we are collecting the stem cells from the bone marrow. And that is why it was called initially as a bone marrow transplant. Nowadays, we collect the stem cell from the peripheral blood mostly. And that is why it is called peripheral blood stem cell transplantation. So these words can be used interchangeably, but stem cell transplantation is a newer terminology.
Same. So we can say a stem cell transplant or a BMT or a bone marrow transplant, they are the same. Okay. So when we deep dive into bone marrow transplant, there are two types of BMT that are happening. One is autologous, the other is allogenic. So how do we differ these types?
Yeah, it's a brilliant question. So autologous stem cell transplant means when the patient himself is a donor. Autologous stem cell transplant philosophy is you are giving some chemotherapy with a supraphysiological dose that only bone marrow can't taken care of. So if you give that chemotherapy particularly, your bone marrow will be totally dried up. You may recover from the cancer, but the patient will die from the total bone marrow failure. So that is the reason we collect the stem cells from the patient body, give the chemotherapy, and we infuse the stem cell and allow the stem cell to recover. So it is basically, nowadays it is called high dose chemotherapy followed by stem cell rescue. So you are giving chemotherapy and rescuing the patient's marrow from the previously taken stem cell. That is the way we call about autologous stem cell transplant. So predominantly in hemato-oncology, autologous stem cell transplant are used for multiple myeloma and the relapse setting of the lymphoma, both Hodgkin's lymphoma and a non-Hodgkin's lymphoma. Allogenic stem cell transplant is a very different type of treatment. It is basically the donor is someone else. It can be fully matched family. Fully matched means HLA matched. That means, in simple language, that immune system is matched. Here, one point I want to mention: blood group matching is not necessary at all. So, family match, one thing. There are now multiple registries in the country where the HLA reports are there of the different normal healthy individuals. You can match with the patient. That we call match unrelated donor. And obviously now we understand the importance of the haploidentical or half match donor transplant, I commonly call. And our advances in clinical science is much beyond in scopes nowadays, and we know that how to tackle that, and the results of the half match bone marrow transplantations also now almost equally good with a full match sibling donor. That is the difference between these two. So I think allogenic stem cell transplantation we mostly consider for the marrow failure problems like a leukemia, like acute leukemia, AML, ALL, aplastic anemia, myelodysplastic syndrome, thalassemia, sickle cell anemia. So these are the diseases we can manage with the allogenic stem cell transplantation.
So I think there is also a very bigger role of HLA matching whenever we need to identify a donor when we are planning to do allogenic transplant. So what exactly is HLA matching?
So in simple language, HLA matching means your immune systems are matching or not. So we have a test, what is called HLA typing, which can be done from either from the blood or from the sputum. Very simple test. Lot of good labs nowadays are doing. So if your HLA matching is full match, that means 12 by 12 match, then you can call it a fully matched donor. Or sometimes you can get half match donor like 6 by 12, 7 by 12, 8 by 12. But below 6 by 12, you can't consider any donor as a proper donor for the particular patient.
So I think within this, it is very important to know the patient or the donor has to be from the family, from the same father and mother.
Not necessarily.
Okay.
Because if you have a very large family, say multiple brothers and sisters, or you have a single brother, still we know that 25% chance that you can get
match.
fully match.
Okay.
So only the big family means your options are more, nothing like that. So around 20-25% patient actually get full match. But what will happen to 75 to 80% other group? So that is why the haploidentical transplant is coming in big way. And with the multiple innovations in medical science, different way of the GVHD management, now we can very much successfully, our half match transplantation results are almost touching the full match transplantation results. So this is definitely coming up a big options and a lot of cure potentials for multiple types of hematological malignancy in our day-to-day practice.
So is there any ideal age for undergoing a bone marrow transplant, or it is all about indication?
So honestly speaking, again, the center expertise matter. So whenever we do for any bone marrow transplantation, age is definitely a criteria, no doubt. But at the same time, the overall fitness means the organ functions. How is the liver, kidney, heart? These are very equally important. So generally 70 up to 70, 72 years old, we can consider for the patient for the transplantation. In our center, highest age, whatever we have done so far is 72 years old for a multiple myeloma patient. Match unrelated donor, half match donor, we have done at the age range of 65 years. For the donor consideration, more or less 70 years again is taken as a consideration. More than 70 plus age donor, we generally don't consider.
And so what are the success rate at your center?
Yeah. So success rate of our centers are too good. So whenever we talk about the success rate, there are two ways. How is the transplant related mortality versus the relapse mortality? So whenever we do transplant, the transplant related mortality in any sorts of allogenic stem cell transplantation is around 15%. So our center data is almost matching the same. There is another cause as the non-transplant related mortality, which is a relapse mortality. So that depends on what type of disease you have. So in general, in leukemia, when you transplant, 15 to 20% patients we see that they get a non-transplant mortality. That is due to relapse. That means the coming back of their disease.
So can bone marrow transplant cure all types of cancers, including lymphomas or sickle cell anemia disorder? So what are the whole spectrum?
So for the lymphoma, if I'm very specific, when there is a relapse of lymphoma happens, we have to use some salvage chemotherapy. What is the meaning of the word salvage chemotherapy? That means to control the disease as much you can, probably in the zero level, layman language, and then you do the autologous stem cell transplantation, which can give you 50 to 60% complete cure for the long term. Sickle cell anemia, thalassemia, any hemoglobinopathies, when we talk about, bone marrow transplantation is only curative treatment for these patients. So if you want any patient of sickle cell anemia or thalassemia wants to be sickle free, thalassemia free, they need to undergo bone marrow transplantation.
And any blood disorder, as per your experience, which you feel is important on the family side to take immediate decision with regards to BMT, which they should not delay?
So hematological cancers like leukemia, lymphoma, multiple myeloma, aplastic anemia, myelodysplastic syndrome. So bone marrow transplantation decision to be very sharp and prompt. Decision should be taken whether this patient is transplantable or not transplantable. So when decision is made, the doing transplant should be done in a very, very in an impressive way, so that the patient should not lose the battle quickly.
And what are the chances of failure in BMT?
Yeah, so whenever we do the standard BMT counseling, we always tell the patients that 50 to 60% is curable, around 10 to 15% chance that transplant related mortality, and 15 to 20% chance that always we say that the patient disease can come back. So if you combine these two, disease can come back, and this transplant related mortality, it is around 20-25% range, not beyond that.
And how much time the patient has to stay in the hospital?
So autologous stem cell transplantation, most of the patient stays 2 to 3 weeks. Allogenic stem cell transplantation patient, mostly they stay around 25 days in our hospital.
Okay,
starting from the day of the initiation of the transplant and the discharge.
So overall, if somebody is coming from a different part of the world, they have to be in the hospital or around the hospital for at least 2-3 months, 3 months.
So 1 month for there and another 1 to 2 months in the country, and they can go back and they can follow their hematologists and medical oncologists. So what we do is to try to form a liaison with the medical oncologists and hematologists in that particular country, so that many of the simple things that can be managed in their own country, which drastically decreases the cost of the patient and obviously the ease and comfort of the patient.
So is there any support we can provide to the patient who goes back after the BMT so that the recovery is better?
Yeah, so what we do, we just try to constantly touch with the patient, and most importantly, I like to keep touch with the consultant hematologist or medical oncologist in that part of the world, so that we can discuss the things, and small things we can discuss, form a solution and give it to the patient, which is very easily doable in nowadays.
So doctor, are there any scams happening on the name of BMT as per your experience?
No. So BMT is not you are taking any organ out, right? So stem cell is a renewable. So when you are taking the stem cells from a patient, a donor, so automatically it will be generated within 5-7 days time. So what word we listen from the liver transplant, kidney transplant world, that we never heard about the BMT world, which is good for us.
So I think some patients also confuse stem cell transplant with stem cell therapy. That is also very important.
So it's $1 million question. So as a hematologist, I don't know how to do stem cell therapy, but yes, stem cell transplantation, what I told you, it is nowadays, it is called peripheral blood stem cell transplantation. Layman language, it is equal to bone marrow transplant. But I'm very honest, I'm totally ignorant of the way how people do stem cell therapy. What are the indications of stem cell therapy? I'm totally unaware of.
So technically there is no outcome, or there is no data which says stem cell therapy is curing sickle cell or any disorder.
Absolutely, you are correct. In hematology, hematological diseases, stem cell therapy has no role.
So I think other people, patients specifically who has certain, undergoing any treatment, or they have someone in the family suffering with any of these disease, they feel if they go for a BMT, they will die. Is it true?
Yeah, so BMT is believed to be a very heavy treatment. But at the same time, you have to remember one thing, BMT is the only curative treatment in most of the hematological malignancies and lymphomas. So you have to understand that. And with the advent of the initiation of the screening of the patient, screening of the donor, infection management, GVHD management, the mortality or transplant-related mortality is drastically coming down in our country. With the multiple centers are booming up, multiple hematologists are getting trained from the different part of the world, different part of the country. So I personally believe the stem cell transplant is basically a boon to a patient, not a curse to a patient.
So basically a patient and the family, they have to take a decision at the right time if their hemato-oncologist is letting them know that this is the only option.
So Mr. Dushman, I was telling one thing very clearly, that patient family and doctors, three should be aligned very well. Then only one successful transplant can come out. And positive mindset, which actually helps. Yes,
that is most important, I think, within the family and of course for the patient as well.
So just one line that I will take. Yesterday I did one stem cell infusion. He's a 63-year-old gentleman. He came from Indore. When I was doing stem cell infusion, I was telling that this thing can happen. बोला डॉक्टर साहब अभी जो कुछ होगा हो सकता है लेकिन मुझे कुछ नहीं होने वाला है. So that is the positive mindset. It actually helps both the doctor and the patient.
Thank you so much, doctor, for joining us and giving us information about blood cancers and bone marrow transplant. Thank you everyone for joining us today. Until next time.